Yeah, don't do threadlifts, please.
Hey you guys, so this is my boob now.
Ooh.
Yeah, basically my breast implant popped again, and I am having surgery to take them out next week. I am gonna go back natural.
Oh, good. Wow.
Or should I just keep it like this?
No, don't keep them like this. You may have seen this influencer who goes by the name Mary Magdalene, and as you can see, she has quite extreme curves. Now, how did her breasts get this big? They don't make breast implants this size. So either she had to go to an actual company to custom make them for her, which is very, very rare, or she has temporary breast implant tissue expanders in. And these are special types of implants that you can actually fill with a needle and make them bigger and bigger and bigger. The problem with implants that, let's say, are 800 cc's, which is the maximum size that is made here in the United States, is that if you overfill them to 1,000, 2,000, 3,000 cc's, like a water balloon that's overfilled, they can burst. And when they burst, they look like this.
Let me take a picture. Hi, buddy! Educational purposes. There we go.
Okay, they are not torturing this beautiful little baby. This is actually called a pig-o-stat. Now, I did not give it this name, but this is a device that's used to safely position a baby for x-rays. So you stick the baby into this device. They're not that uncomfortable. You take the x-ray to make them nice and safe, and then you pull them out. If you follow me for a while, you know I'm not a fan of upper lip lifts. These are operations where you take skin from the bottom of the nose to lift the upper lip up. Well, this is a different way to perform a lip lift, where you actually remove skin at the vermilion border, which is the border between the lip and the skin. I have not seen this procedure in many people, but the ones that I have, the scar looks so not good. The border between the actual lip mucosa and the upper lip skin is one that is not super defined. And now when you define that border with an actual scar, it's never gonna look completely natural.
I wanna know how I got these scars.
So as much as I don't like the upper lip lift with the scar at the base of the nose, I dislike this operation even more. I have a gummy smile too. Now this beautiful young woman showed her after photo for literally less than a second. So if you want to go back and pause it to take a look at how great she looks, go ahead and do that. Well, we all know what a gummy smile is, and I showed you I have one of those too. And there are technically two ways that are most commonly used to treat a gummy smile. In this situation, some of the gingiva, or the actual tissue that was above the tooth, was removed. This can cause a tooth to look longer and can definitely reduce the appearance of a gummy smile. The issue with this, though, is if you already have really long teeth, you don't want to do this procedure because it's going to make them look even longer. The other way to do it, and the way that we do it in most plastic surgeons and dermatologists' offices, is just to use a little bit of Botox. If you inject a little Botox on either side of the nose, just the smallest amount, it can counteract those muscles that lift the upper eyelid up and reduce a gummy smile. Before getting your gingiva removed, I would start with the Botox first.
Watch this.
I've seen this before. This is called pitting edema, and this is what occurs when you have excess fluid that builds up in your body and goes into what we call a third space. This can be caused by certain medical conditions like congestive heart failure, where your heart's not pumping that well and you get this backup of fluid. Or sometimes if you just get a lot of fluid after a normal operation, it third spaces, or it goes into your outer tissues, and then eventually your body gets rid of it by peeing it out.
I used to weigh 600 pounds, and I have worked really hard over the last 4.5 years of my life to lose 370 pounds. And in 4 days, I am having an abdominoplasty surgery to remove my hanging apron stomach. I am a weight loss warrior. I have worked really hard to save my own life. And in a few days, this is all going to be gone, and my life is going to be forever changed for the better. This is what my hanging apron stomach looks like when I am standing up. As you can see, it hangs down a lot. It causes me so much physical and emotional pain, you guys, and I cannot wait for the skin to be removed.
That is called a panniculus, and a panniculus is excess skin that hangs from the tummy. This is very common in people who've lost massive amounts of weight, and she has lost a ton of weight, so God bless her. I really give her kudos for sharing her story and for putting her health first and being able to do this for herself. These operations come with lengthy scars, typically a scar that extends from hip to hip, sometimes all the way around the back as well, and then oftentimes a scar going from the pubic area all the way up to the bottom of the chest. Unfortunately, insurances usually aren't very good with paying for these operations, and they often require patients to jump through tons and tons of hoops, and they don't pay the surgeons much of anything to perform these operations. So it can be hard for patients like her to find a doctor to actually do it and for insurance to help pay for it. I truly wish her the best in this awesome journey that she's sharing with us. Hey, want to know the ultimate skincare secret? It's retinol. With this stuff, you can say goodbye to fine lines and wrinkles and hello to smooth, glowing skin. Retinol, a form of vitamin A, works to reduce the appearance of aging of your skin. This powerful moisturizer hydrates your skin, leaving it soft and supple. And with regular use, you'll see a noticeable improvement in your skin's texture and tone. Check out our online store at younbeauty.com or download the Youn Beauty app on your phone to order yours today. Oh, this is a phenol peel 7 days after the procedure. Look at that. Oh, be careful. Oh, this is a strong peel. Ouch. Wow, it hurts just watching this. Chemical peels can come in many different strengths, and the longer it takes to peel, the deeper the peel is and the more change you get. So on one end of chemical peels are the lunchtime peels. These may take a half hour, you get a little bit of exfoliation of your skin with no downtime at all. On the other end are the phenol peels, and that's what this gentleman appears to have had done. These are peels that can go very deep. You have to be very careful in how you peel the skin. You can only peel one quadrant of the face at a time, because if you do more than that, you can get a fatal arrhythmia and actually die from the procedure. Yes, you can actually theoretically die if you have too much phenol on your skin at one time. But the benefits of a phenol peel is that you can see huge changes of your skin, and it can be great for people who have deep acne scarring, people who have deep lines, as well as a ton of sun damage. Just be very careful if you're going to have this done, because you want to make sure that your doctor is very experienced with it. Or better yet, go for a TCA moderate depth chemical peel and maybe do a couple of those instead of one big, deep phenol peel.
This is life in the big city.
The dog. The dog. The dog. Hi, puppy. The dog.
Oh. Oh, Bouncy. Oh, Bouncy. Bless your little bitty heart.
Tell Megan.
Oh, Bouncy. Oh. Oh.
Gotta never love one like
Oh. Come on.
Get him.
I thought God just answered one prayer, let me be okay. He answered both of them.
Nothing new is sweet till
Because
I'm
this
with
was my last, my second prayer.
And in the street you run free like
Poor
it's only
little
you and me. Jeez, you're something
I can't hear you.
I want to throw in a couple of pet TikToks at the end of this YouTube video, because this one I thought was just so heartwarming, and what a beautiful woman and what a sweet little dog.
How did you die?
I was hugging my best friend.
No, I mean, what killed you?
I don't care. I was hugging my best friend.
This one really touched me, because if you've ever had a dog and had to put your dog down because he or she was too old or sick, you've been in this situation, and you know, and I've been in this situation twice in the last several years, where you're holding your little buddy and you go through this and it's hard, but you know that this is the place for them to be at that time. And so it's one of the hardest things that I've done in the last many years. But in the end, I think to give them such a warm and loving end to their life is so important as well. So if you've been following my TikTok reaction videos, I often will try to throw in one of my TikToks at the end. Let's take a peek of one of those. I'm here for my surgery.
Oh great, who's your surgeon?
Dr. Christian Brown.
Oh.
Are you ready for your operation? I think so. I'm not too nervous. Oh, good. What do you think of my surgeon? He's good, right? Oh, Dr. Brown. Oh, look, we're here. Welcome to the OR. We'll have you sleep in no time. Oh, okay. What do you think about Dr. Christian Brown? Oh, I can't hear you. It's time to go to sleep now. Wait a minute. Is that a surgery textbook that's open over there? Yes, believe it or not, some surgeons actually have open textbooks in the OR with them. I mean, if I do a new operation I haven't done in a while, then I will actually study the operation prior to surgery, but I don't bring an actual textbook in with me because I think that would freak me out if I went to surgery and the doctor had one open like that. So that was pretty wacky, but there are TikTok videos that go absolutely viral that are out there. And we're talking beauty and skincare treatments and recommendations that are just way out there, that are bizarre and potentially harmful. On this video right up here, I react to some of the absolute worst beauty and skincare recommendations made in viral TikTok videos. These will absolutely blow your mind. And remember, eat real food, use clean skincare, and always wait before you operate.